You won't believe what they pulled out of my ear, I said through clenched teeth, trying to joke with the nurse while the pain crawled up the side of my head like static. The humor came out thin. My name was Maya, I was 26, and for 3 stubborn weeks I had blamed a deep, hot ache in my right ear on just an infection. By the time I finally walked into the hospital, the ache had turned into a throbbing pressure that made my jaw feel misaligned, my sleep broken, and everyday sounds, plates clinking, doors closing, sharp and metallic. The emergency department smelled like antiseptic and wet raincoats. A triage nurse named Hannah took one look at me holding the side of my face and guided me to a chair. "How long?" she asked. "And any discharge?" I told her about the ache that escalated to stabbing pain, the faint, sour smell I noticed on my pillowcase, the muffled hearing like someone had pressed a finger into my ear. I left out the part about cotton swabs. I didn't want the lecture everyone on the internet loved to give: don't put anything smaller than your elbow in your ear. They moved me upstairs to ENT, where the fluorescent lights buzzed softly and the hallway walls were lined with framed drawings of inner ears. Dr. Koval, an otolaryngologist with careful eyes and a calm voice, introduced himself and a younger colleague, Dr. Petrenko. "We'll have a look," he said. "If it's a simple otitis externa, we'll get you drops and relief today." He lifted the otoscope, and I braced. The speculum slid gently into my ear canal, and every nerve in my head seemed to wake and hiss. He peered, and his expression changed by degrees: neutral curiosity, narrowing focus, then a frown that didn't disappear. He switched to a microscope and adjusted the focus, asking me to keep still. The room seemed to breathe in with him. "What do you see?" I asked, voice too loud in the quiet. "There's inflammation," he said. "And something else. The canal is narrowed by swelling, and there's debris I can't identify for sure here. We'll irrigate a bit and see if we can get a better view." He stepped back and lowered his tone as he spoke to Dr. Petrenko. I caught only fragments: granulation tissue, keratin, possible foreign material. They set up a tray: saline, a tiny suction, microforceps, sterile drapes. Hannah tilted my head and tucked a soft pad under my neck. The suction whined and tickled at first, then tugged at something inside that felt glued to my bones. My eyes watered. The doctor spoke softly, the way mechanics talk over an engine with a problem that shouldn't be there. "Okay," Dr. Koval said, "there's more than expected. We need to stop. We'll do this under local anesthesia in the procedure room. I don't want to traumatize the canal here." The procedure room was lit like an operating theater. It made even the stainless steel look urgent. "We're going to numb the canal and make a small incision," he said. "We think you have a buildup of keratin and granulation around a nidus, something acting as a core. Once we release the pressure, it should come out in parts." "Is that dangerous?" "It explained your pain," he said carefully. "We'll go slowly." They injected the local anesthetic in tiny burns that faded into a spreading cold. The pain retreated, leaving a hollow awareness of pressure and a thin fear that settled in my throat. The microscope hovered over me. I watched the reflection of gloved hands in a shiny cabinet door and tried to breathe evenly. When the first incision happened, I felt only a distant push, a controlled, expert movement, and then a shift, as if a cork had been loosened in a bottle. Everyone went still. I knew they froze because the suction stopped mid-whine and the gentle chatter ended. In that held second, the room forgot what to do with its hands. "Don't move, Maya," Hannah murmured, squeezing my shoulder. I lay very still, feeling the weight of their silence. "What is it?" I said. The local anesthesia did nothing for the surge of heat in my neck. Dr. Koval didn't answer right away. He leaned closer, and the suction word again, more deliberate, almost reverent. A soft, wet sound. Instruments touched metal. Finally, he spoke, slow and measured. "We're looking at a compacted plug of keratin," he said, "and embedded within it, fibers, cotton fibers, and a small metallic fragment. We need to remove this in one piece if possible. Cotton. My face burned. I remembered all the times I turned a swab inside my ear after showers, the quick shake of water, the tiny satisfaction of a clean white tip, the times the cotton separated just a little and I twisted harder, impatient. The metallic fragment registered a beat later. I thought of bobby pins, the backs of earrings, the clip from an earbud that broke last year. My mind flipped through drawers and bags and sinks and the small daily laziness that accumulates into something with consequences. They worked with patient hands. The suction whispered. A microcurette teased at margins. The microscope transformed millimeters into landscapes. I felt the peculiar sensation of pressure without pain, the way dental work feels when your mouth is numb. Something slid, then caught. It's adhered to granulation tissue, Dr. Petrenko said. There's bone exposure on the posterior wall. The words landed like marbles on a table. Bone exposure. My stomach turned. Stay still, Maya, Hannah said again, closer this time. You're doing so well. They freed the edge first. It took time. The piece came in segments, pearly sheets of keratin that flaked and curled when teased, a felted lattice of cotton fibers gone gray, each fiber a thread that had invited infection and fungus to colonize. The smell shifted from antiseptic to something old and damp. When the metallic fragment finally came into view, it was small, no larger than a grain of rice, corroded and dark. Looks like a fragment of a hairpin, Dr. Petrenko said softly. They set the pieces into a shallow tray, and I turned my eyes, half of me needing to see, the other half wishing I hadn't. The plug looked like something that didn't belong to a human body, a compacted, layered mass with threads woven through it, like a tiny forgotten nest. The metal piece sat in the center as if it had been the seed. It explained the weird taste of pennies I'd noticed on especially painful mornings. It explained how every cotton swab had only pushed it deeper and deeper, pressing the fibers into a tamping ram that built a wall against my own ear canal. When they irrigated after removal, the cool saline felt like relief and shock at once. The suction hummed, the canal breathed. I heard the room differently, more open, oddly bright. There's erosion of the canal wall, Dr. Koval said quietly. Granulation tissue had built up around the foreign bodies. We'll pack with medicated ribbon, start antibiotics and antifungals, and then reassess in 48 hours. If the middle ear is intact, we're fortunate. If the eardrum is perforated, we'll plan for repair once infection is controlled. I swallowed. Is that why the pain felt like it was in my jaw and throat? He nodded. The ear shares nerves with the jaw and throat. Referred pain. It was all speaking the same language. Back in recovery, Hannah helped me sit up. The world tilted, then steadied. She placed a small glass dish on the table beside me with gauze laid open like a white stage. On it sat the evidence of my own habits, flakes of keratin like candle shavings, the quilt of old cotton, and that tiny, ugly shard of metal that had started everything. I stared, not out of horror now, but because it changed the story in my head from mysterious pain to cause and effect. The doctor dictated notes in the corner, steady and specific. In the chart, my pain shaved down to data, but his voice had a gentleness that kept me from feeling scolded. He came over and pulled a rolling stool beside the bed. You did very well, he said. We'll send the material to pathology, not because we expect anything sinister, but to understand the extent of keratinization and confirm the fungal species. You likely had a combination of otitis externa, fungal colonization, and a locally destructive process caused by the foreign bodies. Think of it like a landslide built on the wrong rock. The cotton acted like rebar. The metal was the anchor. I used cotton swabs, I said, because I needed to say it out loud. After showers. And sometimes if it itched. He nodded. You're not the first. The canal is self-cleaning. Swabs feel satisfying, but they push wax deeper, abrade skin, and make it easier for bacteria and fungi to take hold. Add a foreign body, and the body tries to wall it off. It creates keratin and granulation. Over time, pressure builds. You did the right thing by coming in when you did. Would drops have dissolved it? I asked. No, he said. Not with metal and fibers acting as a core. The drops would have soothed inflammation, but the mass would have stayed. It needed to be removed. He printed my prescriptions: an oral antibiotic to cover skin flora, antifungal drops, a medicated wick inside the canal to deliver treatment directly. He wrote follow-up instructions in a looping hand. No water in the ear. No swimming. No swabs. Analgesics as needed. Return in 2 days. Call if fever, severe pain, vertigo, or drainage increased. On the way home, the world sounded dampened in a quieter, safer way. Even the traffic outside the hospital seemed less sharp. I held the discharge papers like a passport out of a place I hadn't realized I'd been trapped in. The pain was still there, less sharp, more sore, like a bruise after a knot had been carefully untangled. The air felt cooler on the side of my neck. I kept hearing the words, bone exposure, and every time, my shoulder rose as if to protect my ear from something invisible. At home, I stood in front of the bathroom mirror, stretched my lips and moved my jaw, testing for the bite pain that had lived with me for days. It was still there, but it no longer had the same authority. I opened the medicine cabinet, stared at the bundle of cotton swabs, and put them in the trash. It felt like deleting a habit I didn't know had written itself into me. The first night's sleep came in patches. I woke, expecting the old bolt of pain, and it didn't come. The ache was duller, more cooperative. In the morning, I went back to the hospital for packing changes. The ENT clinic felt less like a place of threat and more like a place where cause and effect made sense. Hannah greeted me with a smile that remembered me. The medicated ribbon slid out pink and damp, then a fresh coil slid in, cool and oddly comforting. "You're healing," she said. In the adjacent room, I heard a child cry as someone tried to coax an ear exam. The human body complained in so many of the same ways, no matter the age. When Dr. Koval examined my canal under the microscope, he nodded. Less granulation. Clean bed. No purulence. That's good news. What about my hearing? I asked. We'll do tuning forks now, he said. He struck the fork against his elbow and placed it on my head. Where do you hear it? The Weber test hummed through my bones like a low, steady presence. Left, mostly, I said. He nodded. Then the Rinne test, mastoid first, then next to the ear canal. On the right, bone beat air by a narrow edge. Conductive element, he said. Expected, given the obstruction and swelling. When the canal heals and the drum is fully clear, we'll get a formal audiogram. I went home practicing a new quiet. No showers flooding the ear. No headphones that sealed tightly. I learned to tip my head when someone spoke on the right so I didn't miss anything important. The embarrassment I'd felt on the table, about the cotton, the hairpin shard, lifted into something more useful, a promise that made itself easy to keep. At night, when the apartment hushed, I caught the faintest high-pitched hum in the right ear, like a wire in the wind. Tinnitus, the papers had warned. Temporary, most likely, as swelling resolved. I lay still and traced back the chain, a tiny metal fragment, perhaps from years ago, a thread snagged, a habit repeated, a body trying to protect itself in a way that harmed. It felt ordinary and astonishing at once. 2 days later, the pathology report arrived. Dr. Petrenko read it while I sat on the paper-covered bed. Keratinaceous debris with fungal elements consistent with aspergillus, he said. No dysplasia. No cholesteatoma of the middle ear. That's as relief-colored as these reports get. Aspergillus, I repeated. The word felt like gravel in the mouth. It's common, he said. Especially in warm, moist environments. Cotton swabs abrade skin, create microtears, remove protective wax, and you end up with a perfect invitation. The metal fragment gave it architecture. He smiled, small and kind. Your body is quite good at building, even when it shouldn't. By the end of the week, the pain had stepped back enough that I noticed other things again, the sound of my kettle beginning to whisper before it boiled, the neighbor's laugh through the wall, the soft scratch of my pen when I wrote down questions I wanted to ask next visit. Did I need a CT to check the canal wall integrity? How long before I could swim again? Would the tinnitus fade entirely, or would it become one of those background sounds you only hear when you're listening for it? I brought the little metal fragment home in a labeled specimen bag the clinic would have discarded. It sat on my desk, a tiny, ugly teacher. When friends asked what happened, I told them without dramatics because the facts carried their own echo. I told them about Dr. Koval's steady hands, Hannah's shoulder squeeze, the silent second when the room had frozen, and the strange relief of seeing the thing that hurt me sitting outside my body, plain and harmless unless I pretended it wasn't there. On my next follow-up, the canal looked clean and pink. The medicated wick came out for the last time. We'll let it breathe, Dr. Koval said. No water for another week. Then you can ease back to normal. No swabs. If it itches, a little warmed oil on the outer ear only, and wipe what you see. Leave the canal alone. It knows how to move wax out. I nodded, feeling an unexpected swell of gratitude for a part of my body I had treated like a maintenance chore. On my way out, I paused by the framed drawings of ears in the corridor. The little bones, the fragile drum, the curve of canal, the grace with which it all converted air into meaning. Outside, the city sounded less like an assault and more like a conversation I could step back into. At home that evening, I caught myself reaching for an old habit after a shower, hand half lifted toward the cabinet. I stopped, smiled at myself in the mirror, and let my hand fall. In the quiet that followed, I heard something I hadn't heard in weeks, the ordinary hush of a room at rest, a sound so familiar I had forgotten to honor it. I sat on the edge of my bed, tilted my head, and listened to the way a room sounded when pain stepped aside. Then I picked up a pen and began to write down everything, from the clickbait words I had thrown at Hannah to the exact way the suction had sounded when the mask let go, because I knew I would want to remember where this began, and how the doctors at the hospital had turned concern into action the moment they saw what had been hiding inside my ear. You think the worst was over? Not even close, I told Hannah as she peeled back the fresh dressing in the EN clinic, her gloved hands moving with that practiced, gentle certainty that always slowed my pulse. The soreness in my right ear had settled into a manageable throb, but there was a new unease under it, like a floorboard that creaked whenever I took a step. Dr. Koval rolled his stool in beside me, the microscope arching down like a careful bird. Dr. Petrenko stood at his shoulder with a tray of instruments, quiet and intent. He examined the canal and narrated in a way that made my body feel mapped, not mysterious. Epithelial margins looked healthy, he said. No necrotic film. Minimal granulation. That's encouraging. He changed angle, adjusted focus. There's a shallow erosion along the posterior canal wall, about 3 millimeters across. No visible fistula. Drum intact, mildly retracted. Retracted means what, exactly? I asked. It had been pulled inward, he said. Often from chronic negative pressure or obstruction. With the debris gone, the middle ear should ventilate better. We'd still keep watch. He irrigated with a small bulb and warm saline. Then wicked away tiny flecks I could not feel but somehow sensed, the way you sense dust leaving a lens. The suction's purr had become familiar, it no longer frightened me. Any dizziness since the procedure, he asked. Any metallic taste? Any popping? Yesterday, I said, I turned my head too fast and the room shifted for a second. Like an elevator misjudged the floor. It passed quickly. Saying it out loud made me feel both fragile and brave. He nodded. Transient. Not uncommon as the canal recovers. If it lasted, if you had spinning or nausea, we'd look for inner ear involvement. This sounded positional and brief. He outlined the plan with his pen on a blank sheet, sketching a simple ear, canal, drum, middle ear, like a teacher building a diagram for a single student. We'll get a temporal bone CT to assess the canal wall and make sure there's no hidden pocket behind the drum. Not because we saw anything today, but because you had bone exposure and a long-standing irritant. Baseline imaging helps us compare later. Hannah set up the referral while I sat there listening to the way the word baseline steadied me. The appointments fell into place like tiles, CT and radiology, audiology for a formal hearing test, follow-up after both. I took the paperwork and tried to hold it like instructions to a safe place and not a verdict. Radiology waited one floor down from ENT, behind double doors that side open. The technician introduced himself as Mikhail. He positioned my head in a cradle and slid a foam wedge under my neck. "Don't move," he said, a phrase that had ruled my week. The scan was fast and loud in a way that didn't bother me. The noise sounded like a busy kitchen 2 rooms away. I lay there thinking about the small metal fragments sitting in a bag on my desk at home, an ugly seed that had grown a garden of trouble. It felt surreal that imaging now searched for what my eye could never see. Afterward, audiology wrapped the rest of the afternoon. A woman with silver hair and a bright scarf introduced herself as Oksana and guided me into a booth that looked like a tiny recording studio. She placed soft cups over my ears and handed me a button. "Press when you hear even the faintest sound," she said. "Don't guess. Just press when you notice it." The tones came like whispers, each frequency a different thread of sound, some high and glassy, some low and warm. On the right, the threshold felt heavier, like a door with a sticky hinge. After pure tones, she read me words at different volumes, and I repeated them: baseball, ice cream, hot dog, stairway. The ordinary list sounded strange in that sealed space, like a prayer for simple things. When she shared the results, she pointed to a tidy graph. "Mild conductive hearing loss on the right across the low to mid frequencies," she said. "Air-bone gap consistent with swelling and residual fluid. Word recognition excellent bilaterally. You listened like a champion." Her grin reached her eyes. Back in ENT with papers in hand, I found Maya, my own name written across test pages and appointment slips, suddenly looked like a character in someone else's chart. Dr. Petrenko met me at the doorway and waved me in with a warmth that made the corridor feel shorter. "Got your CT prelim," he said. "No middle ear masses, no scutum erosion, no attic retraction pocket. Canal wall shows that shallow cortical nibble we expected. Remodeled bone from chronic pressure, but no deeper breach. So no hidden surprises?" I asked. "Nothing we didn't already know," he said. "No cholesteatoma in the middle ear. Big win." In the chair again, the microscope descended. He used a fine hook to lift a fragile scab of dried medication and granulation, a tiny brown crescent I would have sworn was nothing until it left and the air suddenly felt cooler. "How's the ringing?" he asked. "Quieter," I said. "Like a far-off cable vibrating, not a light inside my skull anymore." He smiled. "Healing sound. Past the clinical steps, life kept its small demands." Work emails gathered. My mother texted twice a day with a cocktail of worry and directives. "Don't wash your hair," she wrote. I told her I had a way to keep water out and had learned to tip my head. I did not write about the moment I had stood in my shower with my head wrapped in plastic, feeling ridiculous and grateful at once. At home that night, I practiced jaw stretches the physiotherapy sheet recommended because Dr. Koval had noted the tension in my masseter and temporalis. He suspected weeks of guarding had made my jaw clench in my sleep. I pressed 2 fingers along my cheek, traced the hinge, opened and closed slowly, counting to 10. The exercise looked silly in the mirror. It felt like the first friendly conversation I'd had with that side of my face in a month. "You have no idea what they found, right?" my friend Lena said over a late call. I could hear cooking in her background, a wooden spoon hitting a pan. Are you going to tell the world you had a hairpin living rent-free in your head? Don't you dare, I said, laughing, and it surprised me when the laugh came easy. It was a fragment. And cotton. Layered. Like an onion of mistakes. You sound better, she said. I sound like someone who got to see the thing that hurt her, I said. And the people who knew how to take it out without making me feel stupid. The next morning, a brief wave of vertigo hit when I sat up too fast, a tilt and then a correction, my inner gyroscope catching up. I noted it the way a scientist notes a cloud, present, not threatening. At the clinic, Hannah asked about it as she took my vitals. Keep track, she said. Hydrate. Move slow. Remind your body it's safe. On exam, the canal looked cleaner again. Dry skin flakes at the meatus, Dr. Koval said. Leave them. No picking. He used a tiny wool applicator to paint the canal with a thin film of something that smelled medicinal and sharp. Gentian violet, he said. Old school antifungal. Stains everything. Don't wear your favorite scarf. I glanced down at my collar and laughed. Noted. He pulled up a photo on the screen, my canal on day 1, furious and narrow, the mystery mass obscuring the drum, and the image from today, wide and pink, the drum a pearly circle. Side by side, they looked like before and after pictures for a renovation show. Bodies remodel, he said. Yours is doing a nice job. We reviewed the list of no's again, not because I needed a lecture but because repetition made a shape my mind could step into. No swabs. No earbuds pushed deep. No water. If it itched, a drop of warm oil at the entrance only. Protect, don't poke. Call if fever, if pain spiked, if drainage changed color or smell. I started noticing other patients in the waiting room. A teenage boy scrolled his phone with the drained look of someone who had not slept, his mother watched the door each time it opened. An older man cupped his hearing aids in both hands like little birds he was afraid to drop. A woman my age dabbed under her ear with a tissue and then tucked the damp square into her sleeve like a secret. We all shared the same corridor, the same posters of sinus anatomy and inner ear diagrams, and the same quiet hope that someone would look inside us and say, this can be helped. A week in, Oksana repeated the audiogram. The air-bone gap had narrowed. Improving, she said, tapping the graph with a pen as if coaxing it along. I like when a line listens. I asked about swimming because the question had been burning a hole in my summer. Not yet, she said. Ask after your next ENT visit. Healing had many steps, and water is a bully. When I returned upstairs, Hannah met me with a grin that told me she had already seen something good in my chart. Your CT final read came in, she said. Nothing hiding behind the drum. The radiologist loved your mastoid cells. Very photogenic bones. That's a compliment I didn't know I wanted, I said. In exam, Dr. Petrenko showed me the axial slices on his screen, scrolling through my head in thin layers. Here, he said, pointing, is the external canal where we did the work. Here's the drum. Middle ear clear. Ossicles intact. Mastoid air cells well pneumatized. No soft tissue masses. No dehiscence. Dehiscence means an opening where a bone wall should be closed, he said. You have none. All walls intact. We sat there a moment, not because there was more to say, but because the absence of bad news needed to be heard in plain silence. He printed the images he knew I would keep. I didn't think I would ever frame a picture of my temporal bone, but I slipped the pages into a folder like something worth saving. By the 4th week, the ache had receded enough that I became reckless with ordinary life. I reached for my headphones, then stopped. Not yet, I told myself out loud. I sat in a cafe with a friend and noticed that voices no longer struck like tacks, they scattered and found their places. I could tell which direction a cup clinked from again. I could hear a bus announce its door closing while someone behind me laughed into their phone, and both sounds layered without scraping at my nerves. At my next appointment, Hannah asked if I had questions I hadn't dared to ask because they felt silly. I surprised myself by having a list. Could a fragment have been there for years? Did I cause this in months, or did I build it slowly like a bad habit with a quiet clock? Why did the pain jump to my jaw? Why did I taste metal? She smiled at that last one. I wasn't the first. Foreign bodies sometimes sit, Dr. Koval said, answering each without making me feel like a cautionary tale. Cotton fibers can weave into keratin over months. Metal corrodes and leaches ions that taste metallic through shared nerve pathways. The ear canal skin is thin, it abuts bone with little cushion. Pressure on bone travels. The trigeminal nerve tells your brain a story that includes your jaw and throat. And the tinnitus? I asked. Will it stay? It had been fading, he said. Many patients notice it fade as swelling resolves and sound pathways normalize. Some keep a faint companion in certain rooms. It doesn't mean harm. It means hearing your own wires when the world gets quiet. I told him about the moment on the table, the silence that fell when he first saw the mass, how time felt like it had paused in the room. He nodded slowly. Everyone in the room reached for attention at the same time, he said. It means the team respected your pain. I like teams that go quiet when it matters. He debrided a last film of dried violet with a microhook. The canal looked like a healthy tunnel now, the drum bright. He smiled. No more packing, he said. Topical drops for 3 days, then stop. Let your skin be skin. As I gathered my things, Hannah tucked an extra copy of the aftercare sheet into my bag because she had started to know me. She wrote a note at the bottom in neat block letters, no swabs ever. She added a small smiley face that felt like a hand squeeze. On my way out, the doors opened onto rain. I pulled up my hood and listened to how rain sounded when I didn't flinch, 1,000 small soft sounds agreeing with each other. I walked to the tram with my right ear turned slightly toward the world and realized that all week I had been doing that without thinking, as if reteaching that side to trust again. You won't believe what I learned about pain, I said to Lena that night, propping the phone on a stack of books while I made tea. It wasn't an enemy. It had been a messenger with terrible bedside manner. What did the message say? She asked. Stop pushing, I said, smiling. And let the right people look. 2 days later, I returned for what they called a final check before spacing visits out, though nothing about it felt final to me. The waiting room was busier, the day gray. A toddler toddled. Someone coughed. A couple spoke in whispers over a paper they held between them. When Hannah called my name, she added a phrase that warmed me, Maya, with the famous hairpin shard. In the chair, under the microscope, the canal looked like it belonged to me again. The skin had a sheen of health. The drum caught the light like a thin moon. He tested my hearing with tuning forks once more, then set them down with the satisfied air of a cook who had tasted a sauce and found it balanced. One more thing, he said, surprising me. He pulled out a small, clear case. Inside lay a pair of soft silicone earplugs shaped to keep water out without sealing sound completely. For showers, he said. Not for daily life. Protect without isolating. Use only until we clear you for swimming. I held them like a small prize. They look like candy, I said. Don't eat them, he said, deadpan, and Hannah laughed from the doorway. Deal, I said. On the tram ride home, a man argued into his phone about a late delivery, and 2 seats behind me, a student whispered her way through vocabulary in a language I didn't know. I let the sounds layer, not pushing them away, not pulling them closer. My right ear felt like someone had cleaned a window I had forgotten was there. Before bed, I took out the specimen bag from the drawer and held the shard of metal up to the light. It looked dull, unremarkable. I thought about throwing it away. Instead, I wrote a label, "Do not forget what this taught you." I slipped it back into the drawer, not as a shrine, but as a guardrail. The next morning, I returned to audiology for one last check before the EN stretched my follow-ups. Oksana greeted me like a teammate. "We measure so we can celebrate," she said, and I believed her. The tones came again, and this time my finger met the button quicker, more often. When she plotted the graph, the right ear's line rose like a small hill easing into a plain. "Improved thresholds," she said. "Air and bone are speaking the same language again." I carried the printout upstairs where Hannah met me with a soft clap. "You brought good news as a souvenir," she said. In the exam room, Dr. Petrenko raised his eyebrows as he read the numbers. "We like this," he said. "We like boring audiograms. Boring is beautiful." "I never thought I'd aim for boring," I said. "But here we are." He leaned back, steepled his fingers. "2 more weeks of gentle living," he said. "Then you ask me about swimming. Then we talk about headphones. Then we pretend cotton swabs never existed." "I already do," I said, and felt the truth of it in my shoulders. "You won't believe what I did with my medicine cabinet," I told Hannah on my way out. "I turned the swab slot into a shelf for tea." She laughed. "That's the best conversion we've had all month." On the sidewalk, the city moved like always, buses and bikes and people negotiating space. I stood for a long minute letting the air touch my right ear and thought about the quiet held in the procedure room when everything first changed, how Dr. Koval had gone still, how Hannah had squeezed my shoulder, how even the suction had paused like a breath. That moment had become my hinge, before, pain with no shape, after, a shape that could be changed. "You want the real click?" I said to the camera in my head, the one that imagined telling this story, maybe one day, maybe to someone who would listen only if I started with a hook. They didn't just pull something out of my ear. They gave me back the part of me that could listen without fear. I tucked the test results into my bag and headed toward the tram, already rehearsing the questions I would ask at the next visit, the way I would say them, the notes I would write after, the simple plan of care I would follow like a map, because Maya, the young woman who walked into the hospital thinking she had only an infection, had learned that even ordinary pain could have a complicated truth, and that truth, once seen, changed everything about how she moved through the ordinary sounds of a day. "You want the part nobody posts online?" I said to Lena a week later as we sat in the hospital cafe, my follow-up number tucked under my phone. Healing felt like paperwork, patience, and saying no to things I used to do without thinking. Steam curled from her tea. I kept my right ear turned slightly away from the chatter by habit. A volunteer wheeled past with a cart of magazines. Somewhere, an elevator dinged. Hannah found me before I finished the cup. "ENT has a spot now," she said, friendly but efficient, and walked me back through the corridor I knew too well. The exam room lights made everything look honest. Dar. Koval lifted the microscope and I settled into the chair like a person who had learned how to be still on command. "The canal looked healthy," he said as he focused. Scant desquamation near the entrance. The drum was intact, mobile. He tapped the foot pedal and a small stream of air puffed against the membrane. "Good excursion." "What about the ache I felt last night?" I asked. "Like a bruise woke up for 10 minutes and then forgot it had a job." "Normal," he said. "Nerves fired and quieted. Watch pattern, not spikes." His voice had that steadying cadence that turned fear into data. "Open your mouth halfway." I did. He pressed along my jaw hinge with a gloved finger, then along the muscles at my temple. "Tender bands," he said. "Your jaw had been guarding for weeks. We can help it unlearn." He printed a sheet with simple TMJ stretches and circled a line about heat packs and soft foods on flare days. Back in the chair, he dabbed a film of oil at the canal entrance to soothe the flaking. "No picking," he reminded me, because he now spoke to the versions of me that lived between visits. I didn't mention the dream I'd had 2 nights earlier, the one where the suction paused and nobody breathed. I woke with my palm pressed over my ear, not from pain, but from a memory that felt larger than the room. On the way out, Hannah stopped me with a small plastic card. Classroom 3, downstairs at 2, she said. We ran a quick session once a month on ear care. 10 minutes. People like seeing a list that fits on one page. I went. The room held 6 chairs and a whiteboard with a rough ear sketched in blue marker. An older woman sat in a coat she didn't take off, a teenage swimmer twitched his knee, a barista on break still wore her apron dusted with espresso grounds. A PA named Timur talked about wax being protective, about canals that clean themselves, about the way cotton swabs turned well-meaning people into their own worst enemy. He showed a video of Celia moving wax outward like a stadium crowd passing a ball. It looked ridiculous and completely sensible. He ended with a line I wrote in my notes: prevention had been unglamorous and undefeated. Questions? He asked. The swimmer raised his hand. Earplugs and caps, Timur said. Dry your ears after. A few drops of alcohol and vinegar mix if your ENT cleared you. He pointed to me. Not you, yet. The barista asked if earbuds counted as swabs. Anything that seals tight and sits long, he said, changed humidity and skin integrity. Be kind. The older woman didn't ask anything, but she nodded at every line as if she had been waiting to hear someone say exactly those words in that exact order. That evening, at home, I rinsed my hair with my head bent like a dancer who had learned a new balance. I dried carefully and slid in the silicone plugs just to feel their quiet shield. The city outside argued with itself in horns and laughter and bicycle bells. I let it. I hit a dip 2 days later. After a perfectly uneventful morning, a sharp sting bloomed in the canal, quick as a match. It startled me enough that I sat down on the floor like the room had tilted. 10 seconds, maybe 15, and it melted to warmth. I stared at the wall until my shoulders unknotted. A half hour later, a thin line of clear moisture tracked onto the cotton at the outer ear. Not pus. Not smelly. Just fluid. I took a photo and sent it through the clinic's portal, not trusting my descriptions anymore. Hannah replied within an hour. Bring the photo and yourself, she wrote. We had room at 4. In exam, the microscope showed the culprit before my anxiety could invent one. A tiny scab had loosened and lifted, the skin beneath it looked pink and new, like the place under a band-aid the day you finally took it off. Breakthrough weeping, Dr. Petrenko said. Not infection. He wickered the moisture with a delicate twist of gauze and left me a droplet of antibiotic steroid at the edge, the way a painter touched the last light into a corner. 1 drop twice today, he said. Message us if it changes color or smell, or if pain stung longer than a minute. I almost laughed with relief at the pettiness of it. I had been primed for a monster. Instead, healing did the boring dance it always did. On my way out, a man about my father's age stopped me in the hall. You're the hairpin girl, he said with a kind smile, and I realized news traveled in a clinic like weather. I'm the cotton tip man. He showed a phone photo of a plug they'd taken from his ear last year. It looked like a small, tragic moth. I kept it a week, he said, embarrassed. Then I threw it away and bought a hat instead of earbuds. We both laughed, and in that moment I felt a fraternity I hadn't asked for and wouldn't have found anywhere else. The next visit brought tympanometry, pressure curves mapped on paper with a machine that looked like a toy printer. Oksana sealed a probe at my canal, and the device hummed. Type A on the left, she said. Type as on the right. Shallow peak. Stiff system from healing. It loosened. She handed me a sheet with a simple cartoon, a pressure mountain in the middle. You had the right shape, she said, tapping the peak. It just needed to breathe easier. Dr. Koval added a nasal steroid spray to the routine after a gentle exam of my nose and nasopharynx. Eustachian tube support, he said. All connected. A puff each nostril, once daily for 2 weeks. He taught me a modified Valsalva to practice carefully, mouth closed, nose pinched, a gentle exhale that made the drum pop. No force, he said. No showing off. I practiced at home and learned my limit quickly. A light pop felt like a relief valve. Anything more felt like a threat. I stopped at light. Between appointments, I worked. I typed for hours with my right ear free, no headphones, speakers low. At first it annoyed me. Then it turned into a minor discipline. I listened to the air in my apartment and learned I had a neighbor who practiced viola at exactly 9 each night, that the elevator cable hummed on soft days, that pigeons had heavier feet than I had ever imagined. The world hadn't changed, I had just tuned it again. You get sentimental about sound when someone tries to evict it, Lena said when I told her about the viola. You used to hate that elevator. I thought it was a complaint, I said. It was a weather report. A month after the procedure, the question I had been saving finally made it onto the page. Swimming? I asked, pushing the word toward the bottom of my list because I didn't want the no to land early. Close, Dr. Petrenko said, peering under the scope with a satisfied hum. Skin maturity looked good. No moisture pockets. No fungal film. We clear you for shallow, clean pools with protection in a week. Lake later. Ocean later still. Respect water. It did not have your back. Pool with plugs, I repeated like a line from a script. No ear dives. No flips. No underwater handstands, Hannah added from the doorway, mock stern. We had a plague of those in July. I grinned. I retired my circus career. We scheduled one more imaging follow-up, not because anyone expected drama, but because orthodoxy made doctors sleep at night. A low-dose CT a month out from the first, to show the canal wall looked the same or better. The radiology tech had a new haircut and the same calm hands. I lay still and watched the machine do its fast ballet around my head. On the way out, near the atrium, a small museum case held a display the hospital curated from old instruments, polished brass ear specula, a crude head mirror, forceps hinged like beetle legs, a handwritten ledger from 1963 with names and diagnoses in looping ink. I stood there a long time. There had been so many Mayas before me, so many versions of Dr. Koval and Hannah and Oksana and Petrenko, steady hands in different decades, different buildings, same work. I sent Lena a photo of the case. She wrote back, "You found your ancestors." That night, rain arrived again. I stood by the window, earplugs on the sill, and listened to it ladder down the glass. My phone buzzed. A message from the clinic portal lit the screen. CT compared favorably to prior, the radiologist wrote. Canal wall stable. No erosive progression. No soft tissue mass. Mastoid aeration maintained. The words read like a weather forecast I had learned to translate, no storm today. The next morning, I carried a small thank you box to the clinic, tea for Hannah, dark chocolate for Oksana, a note for both doctors. I kept it simple. Thank you for your hands, I wrote. Thank you for your quiet second when it mattered. Hannah blushed and tried to pretend she didn't, and then she didn't pretend. You were easy to help, she said. You listened. I needed you to show me how, I said. Before I left, Dr. Koval asked if I had any last questions. I surprised myself. How did you learn to go quiet? I asked. That first day. The pause. You all did it at the same time. He looked amused and then thoughtful. An ENT attending trained me, he said. He liked to say the body announced its hardest truths in whispers. We had only 2 chances to hear them, the first look, and the first cut. He made us memorize the silence between those 2. It kept us from rushing. I wrote that down because it felt like something I didn't want to forget, not just about ears, but about everything that hurt. On the tram home, a child in a stroller slapped the window with both palms and shouted at the rain to look at him. The mother apologized to the tram with her eyes. Nobody minded. The driver announced the next stop, the speaker crackled, and I understood every word. I tucked my chin into my scarf and thought about the specimen bag in my desk drawer and the label I had written for it. I added another sentence in my head, "Do not mistake quiet for nothing." 3 days later, I tested the pool. I stood on the tile with the silicone plugs and the soft cap and every precaution my team had drilled into me. I moved slowly down the ladder. The water folded around me, cool, respectful. I kept my head above the surface and watched the ceiling light smear into white commas. My right ear felt aware but not threatened. I didn't go under. I didn't need to. I swam easy laps until my arms talked and my lungs asked for a rest. On the edge, I pressed a towel lightly to the outer ear and waited for any whisper of trouble. None came. I messaged Hannah a photo of my ridiculous cap and thumbs up from the shallow end. She replied with a sticker of a medal and 3 words, "Proud of you." When I returned for the next check, Oksana pulled up my most recent audiogram with the little hill now flat where it should have been. "Symmetry," she said, delighted. My favorite word. In the chair, the microscope found only normal, skin like skin, drum like drum, canal like a clean hallway. "Routine visits now," Dr. Petrenko said. "Unless you need us sooner." "I liked you better when you were daily," I said, smiling, and meant it, and also meant the opposite. At home, I opened the desk drawer and looked at the specimen bag again. I didn't need it, but I didn't throw it away. It sat there like a period after a long sentence that still had more to say. I closed the drawer and listened to the apartment, kettle building toward talk, the elevator cable's soft announcing line, the neighbor's viola tuning to a note that had once scraped and now sounded like a thread pulling a seam straight. "You won't believe how ordinary this felt at the end," I told the empty room, which was not empty at all. I walked in thinking infection. I walked out knowing the names of every person who turned concern into a plan. I learned what patience sounded like. I poured the tea, sat by the window, and waited for the next small sound to introduce itself, ready, when it did, to hear it without fear, ready to carry it back to Hannah and Dr. Koval and Oksana and Dr. Petrenko if it asked for them by name. "You want the headline I never posted?" I said into my phone's voice memo as I walked back toward the ENT wing for another routine check. Pain didn't make me weaker. It made me precise. The sentence steadied me the way a handrail did on stairs. The corridors smelled faintly of disinfectant and coffee. Nurses moved like notes in a song they all knew by heart. Hannah caught sight of me at the desk and lifted a finger, 1 minute, then came around with that quick, soft smile that made you feel like you were exactly on time. "Room 5, she said. Microscope warmed, Oksana sent the latest audiogram, and the radiologist wrote a love letter to your mastoid air cells again. "I'm going to frame that phrase," I said. "Do," she said. "Put it over your kettle." I slid into the chair and let the headrest cradle me. The microscope's arm eased down until the black circle of its eyepiece hovered above the right side of my face. Dr. Petrenko rolled in, rested his forearms on his knees in that way that meant he planned to talk before he touched anything. "You swam," he said. "I did laps," I said. "No dives. No heroics. Plugs in. Cap on." I looked like a cautious seal. "Cautious seals lived longer," he said, and then he leaned in and began his ritual, light, focus, a feather-soft wick to lift what I could not even feel. Skin looked supple. Drum translucent. No fungal film. No edema. He paused. "You kept your promises." "They were easy to keep once someone wrote them down," I said. "I used to treat instructions like suggestions. This time I treated them like a map." He nodded at that and continued. The suction purr came and went like a breath through a shell. When he finished, he sat back and his eyes warmed. "Nothing to do," he said. Which, in our world, counted as a busy day. "Any symptoms I should admire?" "An itch yesterday that went away when I did nothing," I said. A brief ping of pain that felt like a memory, not a threat. The ringing had faded so far that I had to ask the room to be very quiet to hear it. "Let it be background," he said. It knew how. On my way out, Oksana waved me into audiology for something she called a fun extra. She clipped a tiny microphone near my ear and let me listen to my own ear canal through headphones at a low volume. I heard the soft roar of blood, the small scratch of skin when I smiled. It sounded like standing inside a seashell that had learned my name. "Bodies spoke," she said. We rarely listened. That afternoon, the ENT department ran a short community session in a larger classroom, 20 chairs, a projector, a row of models that looked like plastic seashells sliced open to show their interiors. Hannah convinced me to stay and sit in the back. "Sometimes it helped to see who else shared your corridor," she said. A man with a hearing aid cleaned it with methodical care while a teenager in a swim team jacket spun his goggles in his hands. A grandmother kept unwrapping a mint until it fell to pieces in the paper. A resident named Liza took the front of the room and spoke about the year the way a good guide spoke about a city you had lived in and never really seen, landmarks, alleys, neighborhoods that touched and traded news. She showed a photo of an ear canal blocked by a plug of cotton and keratin that could have been mine's cousin. A few people gasped. Nobody laughed. The room treated the image like a weather map, not a horror, a warning. "Tell me you never saw anyone pull a live bug out of an ear," a man said, half daring, half dreading. "We had," Liza said, and the room leaned forward. "We coaxed it out with oil and patience. The patient did well." She looked at me, not calling me out, but carrying my eye for a second as if to say, "Different stories, same lesson, don't poke, don't panic, get help." When it ended, the group lingered. The swimmer asked about earplugs that didn't make you feel deaf. Liza pulled a box of options like a magician. The grandmother told a story about her husband turning up the TV instead of admitting he needed hearing aids. The man with the hearing aid nodded and smiled like a person who had finally sat on the right side of a truth. I stood by the models and traced the curve of plastic with a finger. A boy, 12, maybe, stared at the ossicles like they were the smallest instruments in an orchestra. "You want another headline?" I whispered into my phone later, riding the tram home. I went to a class about ears and felt like I was back in school for something I actually used every day. The lesson wasn't glamour. The lesson was maintenance. That night, the apartment settled into its evening noises. I placed a warm pack along my jaw, did the slow open-close the sheet had taught me, then rested my palm over the right side of my face and simply felt that everything there belonged to me again. The drawer with the specimen bag sat 2 feet away. I didn't reach for it. I didn't need the proof tonight. 2 days passed quiet. On the third, my phone pinged with a message from the clinic. The temporal bone CT radiologist had added an educational note, an annotated image with arrows pointing to landmarks: external canal, tympanic membrane, malleus, incus, stapes, mastoid air cells. The arrows held captions in clear language. I saved the image like a postcard from a city I had visited under anesthesia. Later that week, I stopped by a pharmacy for saline spray and stood, indecisive, before a wall of cotton swabs. The boxes glowed their clean promise. A woman reached for one, and I felt the old itch to say something. I knew better than to preach. I picked up a small bottle of mineral oil instead and then, without drama, I asked the pharmacist for the softest washcloth they had. "For my ear's new personality," I said. She laughed, not because it was funny, but because the sentence carried relief. "You won't believe who I ran into," I told Lena that evening. "The man from the clinic, Cotton-Tip Man." He held up a hat like a trophy. "Start a club," she said. "We already had one," I said. "We just hadn't named it." The next appointment arrived with a little more life around it. The hospital hosted a volunteer fair in the atrium, tables of brochures and old men with kind eyes and a dog in a vest that looked like it took its job very seriously. Hannah dragged me to a table where the ENT department recruited patient advisors for a brochure rewrite. "We wanted words that sounded like someone who had been there," she said. Not just the words doctors wrote for other doctors. I sat with a small team and read the existing pamphlet, Foreign Bodies of the Ear, Risks, Symptoms, Treatment. It sounded like it had been translated twice and squeezed through a keyhole. I edited on the page with a borrowed pen. Don't say, do not insert foreign objects into the external auditory canal. Say, please don't put anything in your ear. Not even a cotton swab. The canal cleaned itself. You could help by leaving it alone. If it itched, a drop of warm oil at the entrance. If you couldn't hear, call, don't dig. I added a line about shame. If you had put something in your ear and it caused trouble, you would not be the first, and nobody decent would make you feel small about it. Dr. Koval stopped by, read a line, and tapped the paper. Keep that, he said. Especially the part about shame. Shame delayed care. He left, and the dog in the vest leaned its head against my knee as if it had also approved the edit. When I went upstairs, the microscope check took 2 minutes. Pristine, Petrenko said, pleased. He turned the screen so I could see the drum reflect the light like a moon with a thin white halo. Take a picture, he said. People kept the bad pictures. They rarely kept the good ones. I did. I sent it to Lena with the caption, my drum's glamour shot. She replied with a string of hearts and an audio note of her laughing. Outside, the day developed a wind that chased leaves around corners. A vendor on the square hawked cheap earbuds. A teenager tested a pair and grinned at the base. I felt the reflex to warn him and let it pass. Not my job. My job had been my ear and the people who had shared the corridor with me. I kept walking and bought apples. The next morning, a message from Oksana landed in my inbox, a link to a small study summary about how often people presented with ear canal injuries after using cotton swabs and how simple education lowered the number. She had highlighted a line, counseling in plain language reduced recurrence. She added a note, famous hairpin shard girl, want to add 2 sentences for our bulletin board? I typed, I thought pain meant some mysterious enemy. It turned out to be my own habits, mixed with something tiny I didn't even know was there. The team didn't shame me. They showed me what to do next. If your ear hurts, don't poke. Let someone look. I walked the printout down to Ian the same afternoon and taped it to a corner of the board while Hannah pretended not to see because she liked pretending I did things unsolicited. In the waiting room, the teenage swimmer from class sat with wet hair and a towel. He lifted a thumb at me. No handstands, he said, smirking. Coach cried. Coach lived, I said. He grinned. Same. As weeks folded into a rhythm, the hospital became less a place I visited and more a place that threaded through my days with a steady stitch. I learned the smell of the elevator at noon, the way the sunlight hit the third-floor window at 4, the particular click of the microforceps when placed on a tray. I learned the names of 2 receptionists and the coffee preference of the security guard who said, "Good morning, famous hairpin," without looking up from his crossword. I learned that healing looked, in practice, like an accumulation of small, unglamorous decisions that, stacked, became a life without that hot, insistent ache. You won't believe what I don't miss, I said into my voice memo on a bench outside the hospital. I don't miss being brave all the time. The sentence startled me after it left my mouth. It sounded like something someone else would say and I would nod at and then forget. I didn't forget. I wrote it down. Inside, Hannah called my name again, and I went in for another look that felt less like scrutiny and more like a friend checking if you had eaten. The microscope showed nothing dramatic: healthy skin, a drum like a small moon, a canal like a hallway after someone opened the windows. Routine, they called it. The most beautiful word in the building. You want the last headline? I said into my voice memo on the morning of my final yen check. They didn't just fix my ear. They taught me how to live with ordinary care. The hospital felt familiar in the best way, like a train station you knew well enough to navigate without reading the signs. Hannah waved me back with a little flourish, as if inviting me onto a stage we both knew by heart. Room 5, she said. Graduation day. Dr. Koval rolled in with the same steady presence that had anchored the worst moments. The microscope eased down. I settled into stillness like it was a skill I owned now. He lifted a wisp of dry skin from the entrance with a micro-wool applicator, irrigated with a warm, exact trickle, and smiled into the eyepiece in a way you could hear. Canal clear, he said. Drum intact, mobile, reflective. No granulation. No fungal film. No edema. Translation? I asked, though I could already feel the answer in the quiet way the suction stayed in its tray. You're well, he said. No restrictions except the sensible ones we've already made part of your life. Oksana appeared like a punchline delivered right on time. One last measure, she asked. We walked to audiology together, the corridor a ribbon of sunlight. Inside the booth, the tones arrived like tiny flags raised on a hill I had already climbed. My finger found the button without strain. When she plotted the graph, the lines on the left and right finally lay nearly on top of each other, almost boring in how symmetrical they looked. Beautifully unremarkable, she said. Put it on a t-shirt. Back in the exam room, Dr. Petrenko brought up my first scope photo and today's image side by side. Angry red tunnel versus a clean pink corridor, my drum a clear moon. Before and after, he said. Evidence that time plus care beat drama. I pulled a small envelope from my bag and set it on the counter. I brought something, I said. Inside was the specimen bag with the corroded fragment and a neat label in my handwriting that read, "Do not forget what this taught you." I had lived with it long enough. I didn't need to keep it to remember. Would the resident teaching shelf want this? I asked. Not to gawk at patience, just, as a story that fits in a palm. Koval looked at the fragment a long second, the way a craftsman looked at a worn tool. We'll keep it with consent, he said. A reminder that small things became big problems, and that shame didn't belong in the room. He slid the envelope into a drawer marked teaching set and wrote a note with my permission for anonymized use. The act felt ceremonial without being precious. Hannah handed me a fresh copy of the brochure we had marked up together. It had been redesigned into clear blocks and plain words. The line about shame sat in the center like a small light. If you put something in your ear and it caused trouble, you are not the first, we will help, not judge. My name wasn't on it and didn't need to be. The sentences felt like mine anyway. Any last questions you've been saving? Koval asked. Just one, I said. What did you hope I would say today? He thought, then shrugged with a smile. That you forgot about us sometimes. We laughed, and the truth of it warmed the room. They wanted to be there if I needed them, they hoped I would not. We went over the habits one last time, not as rules, but as a way of honoring the new normal I had built. No swabs, no tight-sealing earbuds for long stretches, oil at the entrance if it itched, respect for water, call early if anything changed. He added one line I hadn't heard before. Listen to patterns, not spikes, he said. Body startled. It didn't mean disaster. Patterns told the truth. At the door, Hannah pressed something soft into my hand, a tiny packet with custom-molded shower plugs and a note in her block letters, use when the water feels pushy. I hugged her the professional way patients hugged nurses, hands careful, gratitude unstated and everywhere. In the atrium, a volunteer set up the old instruments display again. This time, tucked into the corner, a small card sat behind glass beside an unremarkable piece of corroded metal and a felted curl of cotton. The card read, foreign material retrieved from external ear canal, used for patient education with permission. Underneath, a last line in smaller type, tiny things, big consequences, kind hands. I wasn't the only person who would see it. I wasn't the point. The point was that someone arriving scared could look at it and feel the room grow kinder by a few degrees. On my way out, the teenage swimmer from the workshop spotted me by the elevators and spun his goggles on 2 fingers. "No handstands," he reported. "No heroics," I said. "Coach cried again," he said, grinning. "Happy tears, I think." We rode the elevator down together and parted at the turnstiles like people who knew each other's small, unglamorous victories. Outside, autumn had arrived with that thin, clean air that made everything sound closer. I walked to the pool because it felt like an honest test. In the locker room, I put in the silicone plugs with the easy respect of someone who had rehearsed the gesture 100 times. I eased into the shallow lane and let the water fold around me. No dives. No flips. I swam length after length with my head high, and when I rested at the wall, I pressed a towel to the outer ear and waited for the whisper that would have once sent me down a spiral. Nothing but the soft echo of my own breath. Lena met me on the deck with 2 coffees. "Headline?" she asked, because she knew me. "I stopped trying to win at pain," I said. "I learned the choreography of care." She laughed. "Not viral. But durable." "Durable is the new viral," I said. We sat there and watched the light break into small coins on the water. I told her about the brochure, the little museum case, the audiogram's boring symmetry. I told her about the sentence Koval had given me, "Listen to patterns, not spikes," and how I had started using it for more than years. Sleep, food, work, the ordinary machinery of a day. I didn't need headlines to prove anything anymore. I had a map. That evening, at home, I stood in front of the cabinet where the cotton swabs had once lived. The shelf now held tea and a folded washcloth. I opened the window. The elevator cable hummed, the neighbor tuned her viola, a bus sighed and pulled away. I turned my head slightly so both ears shared the room equally and waited for the old edge of fear that had once come with sound. Nothing arrived. I set a kettle on and texted the clinic portal one last message, not because anyone had asked for it, but because saying thank you out loud had become a practice: hearing steady, no pain, swimming careful, life normal. Please tell the team I will miss their quiet second. Hannah replied with a single line that read exactly like her: "We'll be here if sound ever feels sharp again." I closed the window partway and listened to the room settle. The right side of my face felt like mine in a way I hadn't even known I had lost until it returned. I lay down and let the ordinary hush rise, a sound so familiar it had once disappeared into the wallpaper of my days. It wasn't silence. It was the gentle inventory of a life with its doors open. Before sleep, I opened my voice memo and recorded the last headline, not for an audience, not for clicks, but for the version of me who would someday need to hear it again in plain words: I went to the hospital thinking infection. I left with my hearing, my patience, and a handful of names: Hannah, Oksana, Dr. Petrenko, Dr. Koval, that now meant steady hands. They found what hurt, took it out, and gave me a map for everything after. Pain didn't win. Attention did. I stopped the recording, turned off the light, and let the room breathe. On the edge of sleep, when the world shrank to the size of a heartbeat, I listened once more to the soft, even quiet running through the apartment and named it, finally, without drama, home.